You trust them with your life. The white coat, the stethoscope, the confident voice telling you everything will be okay. You lie on that cold metal table, vulnerable, exposed, believing that the person standing over you knows what they're doing, that they care, that they won't make mistakes, but they do. And when doctors make mistakes, people don't just get hurt. They get mutilated, paralyzed, brain damaged. They wake up during surgery, feeling every cut. They go in for a simple procedure and never wake up at all. Or worse, they wake up to discover the wrong body part has been removed. The wrong patient has been operated on. The wrong dose has been injected. Today we're entering the operating room. But this isn't a place of healing. This is a chamber of horrors where human error, negligence, and incompetence have destroyed lives. These are the most painful medical mistakes in history, and every single one of them is real. The man who woke up during heart surgery. Willie King was 51 years old, a diabetic. He had circulation problems in both legs, but his right leg was in critical condition. Gangrene had set in. The tissue was dying. The infection was spreading. If the leg wasn't amputated, the infection would kill him. February 20th, 1995, Tampa, Florida, University Community Hospital. Willie was wheeled into the operating room. He had signed the consent forms. He understood what was about to happen. His right leg would be removed below the knee. It would save his life. The surgical team prepared. Nurses laid out instruments, scalpels, saws, clamps. The anesthesiologist administered the drugs. Willie's eyes closed. His breathing slowed. He was under. Dr. Macorine Rolando Sanchez entered the operating room. He was the surgeon, experienced, confident. He looked at the patient on the table. He looked at the legs. He picked up the scalpel. And he began cutting into the left leg. The wrong leg. Nobody stopped him. The nurses didn't question it. The anesthesiologist didn't speak up. The surgical team watched as Dr. Sanchez made the incision, as he cut through skin, through muscle, through bone, as he removed Willie King's healthy left leg. It wasn't until the amputation was complete that someone checked the chart, the consent form, the pre-op notes. They all said the same thing. Right leg, not left. Dr. Sanchez had amputated the wrong leg. Willie King woke up in recovery, groggy, confused, in pain. A nurse came to check on him. She looked at his legs. Her face went pale. She called for the doctor. They told Willie what had happened. They had removed the wrong leg, his healthy leg, the leg that didn't need to be amputated. And now, because the right leg still had gangrene, they would need to amputate that one too. Willie King, who came into the hospital with one bad leg, left with no legs at all. The hospital called it a tragic mistake. Dr. Sanchez claimed he had been given incorrect information. The surgical team blamed miscommunication. But the truth was simpler. Nobody had verified which leg to amputate. Nobody had checked. Nobody had cared enough to make sure. Willie King sued. He received a settlement of nearly $1 million. But no amount of money gives you back your legs. No settlement lets you walk again. Dr. Sanchez kept his medical license. He continued practicing. The system protected him. Willie King spent the rest of his life in a wheelchair. He died in 2001, 6 years after the surgery that destroyed his life. The woman who burned from the inside. Gloria Perez was 16 years old. She had been experiencing severe abdominal pain. Her parents took her to Martin Memorial Hospital in Stuart, Florida. The doctors diagnosed appendicitis, a routine procedure. Thousands are performed every year. Simple, safe. April 9th, 1985. Gloria was prepped for surgery. The surgical team used a standard disinfectant to clean her abdomen, betadine, an iodine-based solution. It's used in operating rooms around the world. Safe, effective. But someone made a mistake. Instead of betadine, a nurse grabbed a different bottle, benzoin, a highly flammable adhesive compound. It looks similar. The bottles were stored near each other. Easy mistake. Fatal mistake. The nurse poured the benzoin onto Gloria's abdomen. She didn't notice the error. Nobody noticed. The surgical team proceeded. The surgeon used an electrocautery device, a tool that uses electrical current to cut tissue and seal blood vessels. It generates heat, sparks. It's standard equipment in surgery. When the electrocautery device touched Gloria's skin, the benzoin ignited. Gloria's abdomen burst into flames. On the operating table, while she was unconscious, while she was cut open, fire spread across her skin. The surgical drapes caught fire. Smoke filled the operating room. The surgical team panicked. They grabbed towels, water, fire extinguisher. They put out the flames, but the damage was done. Gloria had suffered third-degree burns across her abdomen and chest. The fire had burned through skin, through muscle. The heat had damaged internal organs. She was in critical condition. She survived the surgery, but she spent months in the hospital. Skin grafts, infection, constant pain. Her body was scarred, disfigured. She was 16 years old. The hospital called it an accident, a terrible accident. The nurse who grabbed the wrong bottle was not fired. The hospital implemented new labeling procedures. But that didn't help Gloria. She sued, she won, but the money didn't erase the scars. It didn't give her back her childhood. It didn't make her whole. Gloria Perez lived with the physical and psychological trauma for the rest of her life. She became a recluse, ashamed of her scars, terrified of hospitals. The simple appendectomy that should have been routine destroyed her. The boy who got the wrong blood type. Jesica Santillan was 17 years old. She had been born in Mexico with a heart defect. Her family had immigrated to the United States hoping for medical treatment. For years, Jesica waited for a transplant. A new heart, new lungs, a chance at life. February 7, 2003, Duke University Hospital in North Carolina. The call came. A donor had been found. Organs were available. Jesica was rushed into surgery. Dr. James Jaggers was the surgeon. One of the best in the country. The transplant surgery was complex, delicate. It would take hours. But if successful, Jesica would have a normal life. She could go to school, have a career, a family, a future. The surgery began. Dr. Jaggers removed Jessica's diseased heart and lungs. He prepared to implant the donor organs, the new heart, the new lungs. Everything was going according to plan. But something was wrong. Jessica's body began rejecting the organs immediately, violently. Her immune system attacked the new heart and lungs as if they were foreign invaders, which they were, because they were the wrong blood type. Jesica was type O. The donor organs were type A, incompatible, deadly. In organ transplantation, blood type matching is the most basic, most critical requirement. It's the first thing you check, always, without exception. Transplanting incompatible organs triggers massive immune rejection. The body destroys the new organs, and itself in the process. Someone had failed to verify the blood type match. The organ procurement team, the transplant coordinator, the surgeon, multiple people, multiple failures. And now Jessica was dying on the operating table. Dr. Jaggers tried to save her. But the damage was catastrophic. Her body was in shock. Organ failure, brain damage. She was placed on life support. For 2 weeks, Jessica clung to life. Her family prayed. The hospital searched desperately for another donor, another set of organs, the right blood type this time. They found one. A second transplant was performed, but it was too late. The damage from the first transplant was irreversible. Jessica's brain had been deprived of oxygen for too long. She was brain dead. On February 22, 2003, Jesica Santillan was taken off life support. She died. Not from her heart condition, not from her lung disease, but from a medical mistake, a preventable, inexcusable mistake. Duke University Hospital issued an apology. Dr. Jaggers was devastated. The hospital implemented new verification procedures. But Jessica was dead. The girl who had waited years for a chance at life was killed by the very system that was supposed to save her. Her family sued. They settled for an undisclosed amount. But no settlement brings back your daughter. No apology makes it okay. The man who had the wrong kidney removed. In 2016, a patient in the United Kingdom went in for kidney surgery. He had a tumor on one kidney. The diseased kidney needed to be removed. The surgery was scheduled. Routine. The patient was nervous but hopeful. Remove the bad kidney. Keep the healthy one. Move on with life. The surgical team prepped. They reviewed the scans. The tumor was clearly visible on the imaging. Left kidney. The notes were clear. The consent form was signed. Everything was documented. The surgeon began the operation. He made the incision. He located the kidney. He removed it. Clean extraction. No complications. The surgery was a success. Except it wasn't. In the recovery room, a nurse was reviewing the patient's chart. Something didn't match. She checked the pathology report. She checked the imaging. She checked the surgical notes. The surgeon had removed the right kidney, the healthy kidney. The tumor was still inside the patient. On the left kidney, the diseased kidney that was supposed to be removed. The patient woke up to devastating news. The wrong kidney had been removed. He now had only one kidney, and that kidney had a tumor. He would need another surgery, more risk, more trauma. And even if the second surgery was successful, he would have no kidneys left. He would need dialysis for the rest of his life, or another transplant. The hospital launched an investigation. How did this happen? The imaging clearly showed the tumor on the left. The surgical notes said left. The consent form said left. But the surgeon had removed the right. The surgeon claimed he had been confused by the patient's positioning on the table. A left-right orientation error, a simple mistake. But this wasn't a simple mistake. This was a catastrophic failure that destroyed a patient's life. The patient sued. The surgeon was suspended. The hospital paid a settlement. But the patient still had no functioning kidneys. He spent the rest of his life tethered to a dialysis machine. Hours every week. Needles, tubes, exhaustion. All because someone couldn't tell left from right. The child who received 10 times the dose. Dennis Quaid is a famous actor. But in 2007, he became famous for a different reason. His newborn twins nearly died from a medical mistake. The twins were born prematurely. They developed an infection, standard treatment, antibiotics, fluids, monitoring. They were in the neonatal intensive care unit at Cedars-Sinai Medical Center in Los Angeles, one of the best hospitals in the country. The twins needed a blood thinner called Heparin, a common medication, used to prevent blood clots. The standard dose for infants is 10 units per milliliter. But a nurse grabbed the wrong vial. Instead of 10 units per milliliter, she grabbed the adult concentration. 10,000 units per milliliter, 1,000 times stronger. She administered the dose. Then she administered it again, twice. The twins received a massive overdose of heparin. Their blood stopped clotting. Internal bleeding began. They were hemorrhaging. The medical team realized the error. Emergency protocols, transfusions, antidotes. The twins were in critical condition. Touch and go. For days, it was unclear if they would survive. They did, barely, but only because they were in a world-class NICU with immediate access to emergency intervention. If this had happened in a smaller hospital, they would have died. Dennis Quaid went public with the story. He testified before Congress. He became an advocate for patient safety. He demanded accountability, change, better systems. The hospital blamed the medication manufacturer. The vials looked too similar. Easy to confuse. The manufacturer blamed the hospital. Better training, better protocols. Everyone blamed everyone. But the twins almost died. This wasn't an isolated incident. The same heparin overdose error has happened in multiple hospitals, to multiple patients. Some survived, some didn't. Because the vials look similar, because nurses are overworked, because systems fail. And when systems fail in hospitals, people die. These are not rare occurrences. Medical errors kill an estimated 250,000 people in the United States every year. That makes medical mistakes the third leading cause of death, behind only heart disease and cancer. Wrong site surgeries, medication errors, infections, misdiagnoses. They happen every single day, in every hospital, in every country. You go to the hospital to be healed, to be saved, but sometimes the hospital is the most dangerous place you can be. The doctors who make these mistakes often face no consequences. They keep their licenses. They keep practicing. The system protects them. Hospitals settle lawsuits quietly. Non-disclosure agreements, sealed records. The public never knows. And the patients? They live with the consequences, or they don't live at all. The next time you're in a hospital, look around. Look at the nurses, the doctors, the equipment, the medications. And remember, they're human. They make mistakes. And their mistakes can kill you. Verify everything. Ask questions. Check the labels. Make them check twice. Because your life depends on it. This is the painful truth. And the truth is, the people you trust most can hurt you the worst.